Hey, you're tuned into the Deep Dive from Book Podcaster. Let's be real. Sometimes it feels like your brain is trying to run a marathon while your body is stuck in rush hour traffic.
Oh, totally. Like you're just spinning your wheels.
Exactly. Especially when you're juggling, I don't know, a million things. Maybe you're knee-deep in textbooks and feeling like your next exam needs actual magic to pass, sending a big wave of solidarity to all the incredible nursing students out there.
Yeah, absolutely. You guys are amazing.
So today we're tackling something super crucial, something that can make that mental traffic jam even worse: anxiety.
Exactly. Think of this as your backstage pass to understanding anxiety and related experiences. We're going to try and cut through the noise,
Yeah.
all those quick fix articles and maybe overly technical stuff,
Yeah.
and really get to the heart of what's happening when that feeling of unease starts to, well, take over. Our aim is to give you a clear, insightful understanding.
Right. We're going to dig into what anxiety actually is, explore the different ways it shows up, from those everyday butterflies to the more intense experiences that can really disrupt your life. We'll also look at some of the underlying factors at play and, maybe most importantly, talk about some helpful approaches. No dense, snooze-inducing chapters here, promise.
Definitely not. Just some solid info and hopefully a few of those satisfying aha moments. So
Yeah.
let's start by unpacking the core of anxiety. At its most fundamental level, anxiety is an emotional response to what we perceive as a threat.
A perceived threat. Okay.
Right. Now, what's really interesting is that this perceived threat is often future-oriented.
Mm.
It's about something that might happen.
Yeah.
And sometimes the source of that feeling can be really vague, almost like this shadowy worry you can't quite pin down.
That's it, isn't it? It's not just the stress of like an immediate deadline.
Oh.
It's that persistent underlying hum of worry, even when things on the surface seem relatively calm.
Exactly. Yeah. But it's so important to recognize that there's a real difference between that normal level of anxiety we all experience
Uh-huh.
and when it starts to become something that really impacts your ability to function.
Right. So normal versus not so normal.
Precisely. Normal anxiety can actually be quite adaptive. Think about those pretest jitters again, that little bit of nervous energy. It can sharpen your focus, help you prioritize.
Make him motivated.
Exactly. Drive you to perform better. That's anxiety serving a purpose. Pathologic anxiety, on the other hand, is when this response becomes excessive and it starts to interfere with your daily life.
How so?
Well, it can lead to avoidance of situations, difficulty concentrating, and just this general sense of distress that's really hard to shake.
And one of our sources, Townsend, offers a really insightful definition here. It says, anxiety is an emotional response to anticipation of danger, the source of which is largely unknown or unrecognized.
That bit about the unknown source.
Yeah, that emphasis on the unknown threat really resonates. It highlights how unsettling it can be when you can't even identify what's making you feel so uneasy.
It does. That lack of a clear target can make it feel, I don't know, pervasive and just harder to address.
Definitely.
So to better understand the different ways anxiety can manifest, we can look at Hildegard Poplaw's theory. She described 4 distinct levels of anxiety.
Okay.
This helps us see anxiety not as just one thing, but more like a spectrum.
A spectrum. Okay, let's explore these levels. First up is mild anxiety. What's happening there?
Well, mild anxiety actually leads to a heightened perceptual feel.
Heightened, so like more aware.
Exactly.
Yeah.
Think of it as your senses becoming a little sharper. You're more alert, more aware of your surroundings. That slight increase in adrenaline from those pretest jitters we talked about, that can actually improve your ability to take in and process information.
That makes sense. It's like a little mental amplifier. Okay, what about the next level? Moderate anxiety. How does that shift things?
In moderate anxiety, the perceptual field starts to narrow a bit. You become more focused on the immediate concern, and while you can still pay attention to other things, it might take more effort.
So harder to multitask.
Kind of. You might have some difficulty recalling details or connecting different pieces of information. You might benefit from someone gently, redirecting your attention back to the task.
Okay.
Imagine being in the middle of a complex nursing procedure and suddenly feeling a wave of worry. You might need a colleague to just gently remind you of the next step.
Gotcha. Okay, so the focus is becoming more restricted. Then we move into severe anxiety.
Yes, with severe anxiety, the perceptual field becomes very narrow. You're primarily focused on the immediate threat or discomfort. Cognitive processing is significantly impaired.
Impair how?
You might struggle to follow even simple instructions and might really need clear, direct guidance. Physical symptoms also tend to become much more pronounced at this stage.
Okay, wow. And finally, the most intense level, panic. What characterizes a state of panic?
Panic involves a significant disruption of rational thought. People experiencing panic might exhibit really extreme reactions, like screaming, becoming physically immobile, or freezing up.
Freezing.
Yeah, or even in some instances, having perceptual disturbances or hallucinations.
Yeah.
It's a feeling of being completely overwhelmed and losing control.
That sounds incredibly distressing. And the nursing tip for this level is so critical, right?
Absolutely critical. If someone is in a state of panic, it's paramount not to leave them alone. Your calm presence and clear, simple directions can be a lifeline.
It's about providing that sense of safety and grounding in that moment of intense fear.
Exactly. Now, shifting from these levels of anxiety to more persistent patterns, the DSM-5, which is the standard diagnostic manual for mental health,
Right, the DSM-5.
it outlines specific anxiety disorders. These are more than just, fleeting feelings of anxiety. They involve specific criteria, they happen frequently, and they significantly impact a person's life.
Okay. So what are some of the main anxiety disorders that are recognized?
Well, one of the most common is generalized anxiety disorder, or GAD.
GAD. Okay.
The hallmark of GAD is persistent and excessive worry about a whole variety of topics for at least 6 months.
6 months. Wow.
Yeah, people with GAD often feel restless, easily fatigued, have difficulty concentrating, are irritable, experience muscle tension, and have trouble sleeping. It's like their internal worry dial is constantly cranked up.
That constant state of worry must be just incredibly draining. What are some other key anxiety disorders?
Then there's panic disorder. This is characterized by recurrent, unexpected panic attacks.
Unexpected, so they just come out of the blue.
Often, yes. These are sudden surges of intense fear or discomfort that peak within minutes. They include a range of physical and cognitive symptoms,
Like what?
like a racing heart, shortness of breath that's dyspnea trembling, dizziness, feelings of unreality, or feeling like you're losing control. And the fear of having more attacks is also a big part of panic disorder.
Those panic attacks sound absolutely terrifying. And they can understandably lead to other challenges too, right? Like developing agoraphobia.
Precisely. Agoraphobia involves a marked fear or anxiety about being in situations where escape might be difficult, or maybe help wouldn't be available if they started having panic-like symptoms.
Situations like.
Things like public transportation, open spaces, enclosed spaces like elevators, being in a crowd, or even just being outside of their home alone. Often, agoraphobia develops because someone's had panic attacks and starts avoiding places they associate with those attacks.
Right.
In severe cases, this avoidance can become so pervasive that people become essentially homebound.
That real-life example in our sources of Maria, whose heart races in crowded elevators, and now she avoids them completely because she has this overwhelming fear of dying during an attack. That really illustrates the debilitating nature of panic disorder with agoraphobia.
It really does. It's not just a fear of elevators, it's the fear of the panic itself and that feeling of being trapped.
Yeah.
Then we have social anxiety disorder, also known as social phobia.
Okay, social anxiety.
This involves a significant and persistent fear of one or more social or performance situations where the person feels they might be exposed to scrutiny by others.
Scrutiny, like being judged.
Exactly. The individual fears that they'll act in a way or show anxiety symptoms that will be negatively evaluated. It's much more than just being shy. It's an intense fear that can significantly interfere with daily life, work, or school.
And there are also specific phobias, which I think most people can kind of understand on some level, even if their own fears aren't, clinically diagnosable.
Absolutely. Specific phobias are characterized by a marked fear or anxiety about a specific object or situation. Think spiders, flying heights, needles, that kind of thing.
Right.
The fear is way out of proportion to the actual danger posed, and the person typically goes to great lengths to avoid it or just endures it with intense fear or anxiety.
We also see anxiety disorders that tend to show up more in childhood, like separation anxiety disorder.
Yes, separation anxiety disorder is characterized by excessive fear or anxiety about being separated from attachment figures like parents or caregivers.
Isn't some of that normal for little kids?
Some separation anxiety is definitely a normal part of early development, but in this disorder, the distress is developmentally inappropriate and causes significant problems in the child's functioning at school, at home, or socially.
Okay. And selective mutism is another one, often starting in childhood.
That's right. Selective mutism involves a consistent failure to speak in specific social situations where there's an expectation to speak, like at school, even though they can speak perfectly fine in other situations, like at home. It's not because they don't know the language or anything like that.
Got it. Okay, so that gives us really good overview of the different types of anxiety disorders. Now let's shift focus slightly and talk about obsessive compulsive disorder, OCD, and related conditions.
Okay.
They used to be grouped under anxiety disorders, I think, but the DSM-5 now classifies them separately. But they definitely seem related.
They are very related, yeah.
Yeah.
They share some underlying mechanisms and often involve significant anxiety. So, obsessive compulsive disorder, OCD, is characterized by obsessions and compulsions.
Obsessions and compulsions, what's the difference?
Obsessions are recurrent and persistent thoughts, urges, or images that feel intrusive and unwanted. Compulsions are repetitive behaviors or mental acts that the person feels driven to perform, often in response to an obsession or according to rigid rules.
And they do the compulsions to, what, feel better?
Often, yes.
Yeah.
The goal is frequently to prevent or reduce anxiety or distress, or to prevent some dreaded event or situation.
Right.
But the key thing is, these compulsions aren't realistically connected to what they're trying to prevent, or they're clearly excessive.
That real-life example of James washing his hands like more than 30 times a day because of this intense fear of germs, even though his hands are raw and he knows it's excessive, that really highlights the struggle with OCD.
It really does. He's trapped in this cycle of intrusive thoughts and these compulsive behaviors that he feels powerless to stop.
Yeah.
And there are several related disorders. Body dysmorphic disorder, or BDD.
BDD.
That involves a preoccupation with one or more perceived defects or flaws in physical appearance that are either not observable or appear really slight to others.
So they see flaws others don't.
Exactly. And they perform repetitive behaviors like mirror checking, excessive grooming, skin picking, or mental acts like constantly comparing their appearance to others, all in response to these appearance concerns.
Then there's hoarding disorder, which has gotten more attention recently as its own thing.
Yes, hoarding disorder is characterized by persistent difficulty discarding or parting with possessions, regardless of their actual value.
Even if it's junk.
Even if it's things most people would consider junk. This difficulty results in possessions accumulating and cluttering up living areas, making them hard to use for their intended purpose. The distress someone feels at the thought of discarding is a key feature.
Okay. We also have trichotillomania and excoriation disorder. Could you briefly explain those?
Sure. Trichotillomania, that's the hair-pulling disorder. It involves recurrent pulling out of one's own hair, leading to noticeable hair loss, even though the person tries repeatedly to stop.
And excoriation.
Excoriation disorder is skin-picking disorder. It's characterized by recurrent skin picking that results in skin lesions, again, despite repeated attempts to decrease or stop the picking.
So it's clear that anxiety and these related conditions can show up in a whole lot of ways, often causing significant distress and impairment. Which brings us to the big question, why? Why does this happen? What causes these conditions?
That's the million-dollar question, isn't it? The development of anxiety and related disorders is really complex. It's almost never just one single cause.
Right.
It's usually a combination of biological predispositions, psychological factors, and environmental influences all sort of interacting.
Okay, let's start by looking at the biological factors. What does the research tell us about the role of our biology?
Well, from a biological perspective, there's evidence suggesting that people with anxiety disorders might have differences in brain structure and function. For instance, the amygdala.
That's the fear center, right?
Exactly, plays a key role in processing fear and threat. It might be overactive in people with anxiety. There also seem to be imbalances in certain neurotransmitters, those chemical messengers in the brain,
Like which ones?
particularly GABA and serotonin, which are involved in regulating mood and anxiety. And furthermore, studies, especially twin studies, have shown a pretty significant genetic component.
So it can run in families.
It suggests that some individuals have a greater inherited vulnerability to developing these conditions. It's not about a single anxiety gene, though. It's more likely a combination of genes that can increase susceptibility.
Okay, so there's definitely a biological foundation for some people's vulnerability. What about the psychological perspectives? How do our thoughts and experiences shape anxiety?
Well, psychodynamic theories propose that anxiety can stem from unconscious conflicts, maybe unresolved issues from the past. The anxiety we feel now might be a manifestation of these repressed inner struggles trying to come out.
That's a fascinating perspective. And what about cognitive factors? How do our thought patterns contribute?
Cognitive theories really emphasize the significant role of, well, maladaptive or distorted thinking patterns in both developing and maintaining anxiety.
What kind of patterns?
Things like catastrophizing, where you automatically assume the worst possible outcome in any situation. Or selective abstraction, focusing only on the negative details and ignoring the positive ones.
Right, only seeing the bad.
Exactly. And overgeneralization, drawing broad negative conclusions based on maybe just one single event. These negative thought patterns can really fuel feelings of worry and fear, creating this kind of vicious cycle of anxiety.
That makes perfect sense. If your internal monologue is constantly predicting disaster, you're naturally going to feel anxious. And finally, what about the behavioral perspective? How do we learn to be anxious through our experiences?
The behavioral perspective suggests that fears and anxieties can be learned through processes like classical conditioning.
Okay.
Our sources provide a great example. A child who gets bitten by a dog might develop a phobia of all dogs. They've learned to associate the neutral stimulus, dogs in general, with a really negative and fearful experience, being bitten.
So they generalize the fear.
Right. And anxiety can also be learned through observational learning just by watching the anxious reactions of others, maybe parents or peers, and internalizing those patterns.
So it's a really complex picture. You've got biological threads, psychological threads, behavioral threads, all interwoven.
Exactly.
Now, let's move on to what can actually be done to help people struggling with these conditions. Our sources outline both pharmacological medication-based and therapeutic non-medication-based interventions. Let's start with the meds.
Okay. There are several classes of medications commonly used to manage anxiety and related conditions. Selective serotonin reuptake inhibitors, SSRIs,
Like Prozac, Zoloft, things people might have heard of.
yes, like sertraline and paroxetine. They're often considered the first-line pharmacological treatment for GAD, panic disorder, and OCD. They work by increasing the levels of serotonin in the brain.
And serotonin helps with mood and anxiety.
That's right, plays a crucial role there.
And we also have SNRIs, right? How do those differ?
Yes, serotonin norepinephrine reuptake inhibitors, like venlafaxine. They're another class of antidepressants that can be effective, particularly in treating GED. They work similarly to SSRIs, but affect both serotonin and norepinephrine levels.
Okay. What about benzodiazepines? We hear about those quite often for anxiety, like Xanax or Ativan.
Right. Benzodiazepines, such as lorazepam and alprazolam, are fast-acting. They can be very effective in the short term for reducing acute symptoms, like during a panic attack.
How do they work so fast?
They work by enhancing the effects of GABA, another neurotransmitter that has a calming effect on the brain. However, and this is really important, benzodiazepines carry a significant risk of dependence.
Dependence and addiction.
Yes, and they can lead to withdrawal symptoms if stopped abruptly. So their use is generally recommended for short-term management only, and always with careful monitoring by a healthcare professional. That high addiction potential and withdrawal risk is a major caution. Use short-term only.
That's a really crucial point to underscore. Definitely not a long-term solution, usually. What are some other medication options?
Well, there's buspirone, often known by the brand name Buspar. It's another anti-anxiety medication often used for longer-term management of GED.
How's it different from benzos?
It works differently, it's not typically sedating, and it doesn't carry that same risk of dependence. Then there are beta blockers, like propranolol.
Aren't those for blood pressure?
They are, but they're sometimes used off-label to manage the physical symptoms of anxiety, especially performance anxiety, things like rapid heart rate, sweating, tremors.
Ah, interesting.
And finally, antihistamines, like hydroxyzine. They can have a sedative effect and can be used to help manage anxiety symptoms, particularly if sedation is okay or even helpful, and they don't carry the addiction risk of benzodiazepines.
So, quite a range of pharmacological tools available, each with its own pros and cons. But it's generally understood that medication is often most effective when it's combined with therapeutic approaches, right? Therapy.
Absolutely. Medication can help manage symptoms, but therapy really helps address the underlying patterns. Cognitive behavioral therapy, or CBT, is a leading form of psychotherapy for anxiety and related disorders.
CBT, how does that work?
CBT focuses on helping individuals identify and challenge their negative and unhelpful thought patterns and develop more adaptive coping mechanisms.
So, changing the way you think.
Exactly. And how you behave in response. This can involve techniques like thought-stopping learning to interrupt those negative thought spirals, or cognitive restructuring, also called reframing, changing the way you look at situations, and challenging catastrophic beliefs by actually examining the evidence for and against them.
Makes sense. We also have exposure therapy, which sounds particularly useful for phobias and maybe the avoidance we see in OCD. How does that work? Sounds kind of scary.
It can seem scary, but it's done very carefully. Exposure therapy involves gradually and repeatedly exposing the person to the feared object, situation, or thought, but in a safe and controlled environment.
Gradually. Okay.
The goal is to help them confront their fears and learn, essentially, that the feared outcome is unlikely to happen, or maybe more importantly, that they can cope with the anxiety that comes up.
Can you give an example?
Sure. Someone with a specific phobia of spiders might start by just looking at pictures of spiders, then maybe progress to being in the same room as a spider in a sealed container, always with the therapist's support.
Okay.
For someone with OCD, it might involve resisting the urge to perform a compulsion after being exposed to a trigger like touching a doorknob and not immediately washing their hands to break that cycle of anxiety and compulsion through a process called habituation. They learn the anxiety eventually goes down on its own.
And systematic desensitization builds on that by adding relaxation techniques, correct?
Exactly. Systematic desensitization is a type of exposure therapy that combines that gradual exposure with relaxation techniques, like deep breathing or progressive muscle relaxation.
Why combine them?
The idea is to help the person learn to associate the feared situation with a state of calm rather than anxiety, replacing the fear response with a relaxation response.
And we shouldn't overlook the value of just general practices like mindfulness and relaxation training.
Definitely not. Techniques like deep breathing exercises, guided imagery, progressive muscle relaxation, and mindfulness meditation can be incredibly helpful.
How so?
They help manage immediate anxiety symptoms, but they also build overall resilience to stress over time. They help people become more aware of their thoughts and feelings without judgment and develop skills to actually calm their own nervous system down.
Our sources share a really encouraging real-life example. A teenager with social anxiety who, with CBT support, slowly started joining school clubs and gradually built their confidence to the point where they actually felt comfortable enough to go to prom. It really highlights the power of those gradual steps and the right therapeutic support.
It really does. It shows that change is possible, even when things feel really stuck.
So for nurses and other healthcare professionals listening, developing comprehensive nursing care plans for individuals experiencing anxiety is crucial. Where does that start?
It always starts with a thorough assessment. You need to look at the history of the anxiety, potential triggers, the nature and intensity of both physical and psychological symptoms, any avoidance behaviors the person is engaging in, and very importantly, always assess for any risk for suicide or self-harm. That's critical.
Absolutely. And based on that assessment, what are some of the key nursing diagnoses that might pop up?
Common nursing diagnoses related to anxiety disorders could include things like ineffective coping, anxiety itself, fear, feelings of powerlessness, maybe social isolation, especially with conditions like OCD or phobias where avoidance is a big feature.
And what are some essential nursing interventions? What can a healthcare professional actively do to support someone who's really anxious?
Well, interventions can include just staying physically present with a patient who's having a panic attack. That provides reassurance and a sense of safety.
Just being there.
Yeah, communicating calmly, using short, clear, simple phrases that's easier to process when someone's highly anxious. Encouraging the patient to express their feelings can be therapeutic in itself.
Right.
Gradually introducing feared stimuli in a controlled, supportive way that's part of those exposure-based interventions we talked about.
Right.
And consistently reinforcing the patient's use of positive coping skills helps build their confidence and their belief that they can manage this.
That nurse script example we have really brings to life how to respond in a panic situation. You're safe. I'm right here with you. Let's breathe together. Inhale, exhale. That calm, grounded presence can be so incredibly anchoring.
Absolutely. It cuts through the chaos.
Yeah.
And a vital component of overall care is providing thorough client and family education.
Why is education so important?
It's so important to explain the nature of the anxiety disorder clearly, understandably, reassuring individuals that, look, anxiety is a real condition. It's not your fault. It's not a sign of weakness. That validation is huge.
What else should be included in that education piece?
Teaching practical skills, like those breathing and grounding techniques we mentioned. That empowers people to take an active role in managing their own symptoms.
Gives them tools.
Exactly. Encouraging the use of a journal to track triggers and responses can help them spot patterns and develop greater self-awareness. And involving family members is crucial.
How so?
Teaching family how to provide support in a way that's helpful, but doesn't inadvertently enable or reinforce avoidance behaviors. It's a tricky balance sometimes.
Yeah, I can see that. Finally, our sources include this really inspiring case study about Elijah. He's a 26-year-old artist whose significant fear of flying was really holding back his career.
Elijah's story is such a powerful illustration of the potential for recovery. His fear of flying was so intense it actually prevented him from accepting this prestigious art residency over in Europe.
Wow, that's huge.
Yeah, a major setback for his career dreams. But through a course of cognitive behavioral therapy and some carefully planned exposure therapy, he gradually confronted his fear.
How did he start?
Started small, looking at pictures of planes and then visiting the airport just to watch them take off and land.
Uh-huh.
And eventually, step by step, he was able to actually board a plane and travel.
That's amazing.
It really is. He now regularly flies for exhibitions and collaborations. He truly reclaimed a significant part of his life and career that was previously just shut down by his anxiety.
What a fantastic outcome. It's such a powerful reminder that with the right support, the right interventions, significant progress and recovery are absolutely possible.
Well, absolutely.
So as we bring this deep dive into anxiety and related disorders to a close, what are the main takeaways you'd really like our listeners to remember?
I think the most important things are, remember that anxiety exists on a broad spectrum. There are many distinct, recognized forms. Understanding that crucial difference between normal, adaptive anxiety and when it becomes a clinically significant disorder, that's key.
Right.
And perhaps most importantly, just knowing that there are well-established and effective treatment approaches out there, both medication and therapy, that offers real hope and pathways to recovery for people who are struggling.
Absolutely. And if anything we've discussed today resonates with your own experiences or maybe someone you know, please note that reaching out for support is really a sign of strength and self-awareness. It's not weakness.
Not at all.
There are effective treatments available, and you really don't have to navigate these challenges on your own.
Okay, we covered a lot of ground today,
We did.
but hopefully this has provided you with some clarity and maybe some helpful insights. Remember, you've got this. Take a moment to breathe. Be kind to yourself, okay?
Definitely be kind to yourself.
And we'll catch you next time for another deep dive.